My first experience with telehealth started this past August when I was about to take a trip to Colorado. Having a history of bad asthma, my friends told me that I should probably get altitude sickness medication before my trip. Coming from Chicago and being in Kansas, I had no way to go to my primary care physician and get easy access to this medication. Luckily, I found an app called Teledoc where I was able to log on, enter my health insurance information and my information, pay $10, and set up a time where I could talk on the phone with a doctor and get the medication very easily. This was extremely helpful. This experience pushed me to research about telehealth around the world. I was extremely curious about how telehealth worked in other countries. Telehealth is a practice of providing healthcare services through the use of technology. And I think telehealth is extremely important because it's an upcoming resource we need to start using. The ability to reach rural areas is a great resource. The access is effective and you still get the same results when you talk to a different doctor versus your primary care physician. It's a low cost. Personally, I only had to pay $10 for the consultation and my insurance covered the medication I received. And time management. I was able to schedule an appointment that fit my time schedule and I didn't have to wait in a waiting room or wait on a doctor. I now want to share with you 5 countries' stories about their way of implementing telehealth. First off is India. India's study was called the World Health Partners Sky Program. It was launched in 2011 and lasted 3 years. The study was designed to improve children patient care. Half the testing group was given telehealth and half wasn't, and the data collected was before and after the implementation of telehealth. What researchers were looking for was the quality of service between telehealth and not having telehealth. After the study had concluded after 3 years, researchers found a large gap between quality of services. The gap was too large between providers' knowledge of care and the actual care patients received. India is not quite ready to fully implement telehealth or have these kind of programs because their research shows that it is not much help to their country. Next up is the country of Australia. Australia tested the use of video chat telehealth and they launched their project in 2013. The focus was on orthopedic consultations. This appealed to many patients, especially those in rural areas who didn't have access to drive to the doctor. The downfall of this research, I believe, is using orthopedic consults. The research showed that the video telehealth provided accurate diagnoses but didn't alleviate the need for face-to-face. And I think this is because in orthopedic consults, patients are going to need x-rays. If they have fractures, they still have to go to the doctor, or any other bone problems. They need that face-to-face component. The second study looked at the barriers and benefits of telehealth in the country. Most of the barriers were focused on the disruption of workflow and the need for a universal system of telehealth. The benefit is how much the patients enjoy using telehealth, how easy they found the access that they were given using telehealth. However, in the end, it turns out Australia is also not quite ready for telehealth and does not have the research to provide them funding to use it. Next up is the United States. The United States are the leaders in telehealth right now. The first study I found focused on environmental and travel savings with telehealth. The data collection lasted 17 years, and at the end of the collection, they found out that using telehealth saved United States 5 million miles of travel, 9 years of time spent at the doctor in waiting rooms, traveling there, and $2 million of the cost of healthcare. The next study I looked at looked into how talked about telehealth is, which may not come to your mind at first, but is a very important aspect. They found there was 137 documented telehealth services. And through those, there were only about 30% actually were implemented into our society, which is only about 40 programs, which isn't even one per state. There's a large variation in the quality of care in telehealth, so I think that is the United States' next step to really tone how telehealth is used here. Next up is my personal favorite study in China. China created a mobile messaging system designed for schizophrenic patients. So schizophrenic patients downloaded the application on their phone, and it was designed for medication adherence. And this app relieved a lot of pressure for caretakers for schizophrenic patients, and it included 4 key parts. The first part being the e-platform, which is a reminder system to take medications. Next is the rewards part, which patients were rewarded for replying to the reminder messages for their medication. Third is the lay health supporters, which is where the support system comes into play here, and it designates one person to support the use of the app with the schizophrenic patient. And then finally, integration, which is the alert system used when a patient is unresponsive to a text or voice reminder for the medication. This project was wildly successful and was used throughout China and shows that they have a great resource to launch more use of telehealth. Finally, I want to share with you the United Kingdom. They are kind of second place behind the United States, and they designed a phone call service system for depression patients. This study dated back to 1998, so I wanted to show you guys how long telehealth has been working its way into our healthcare system. The system was used by having depression patients call therapists and have their session that way. This alleviated the need for driving to an actual therapist and taking the time to sit there and stuff like that. This way they could do it from their home, they could do it on their schedule, and it was wildly successful and implemented all over the country. And the results were very encouraging for people who didn't have access to in-person therapy as well. The last point I want to show you guys is how easy it is to use telehealth. Through these pictures, you can see a wide variety of parents, grandparents, children, all using their phones to FaceTime. It's as easy as that to access to talk to a doctor instead of your grandparents. Anyone can use telehealth. So my final question for you guys is, as HIM professionals, what can you do in your community or your workplace that can change the way we see telehealth or implement telehealth more?